Yeah, good job. Hmm?
Hold on to me as we go, as we roll down this unfamiliar road. Although this way is stringing us along, just know you're not alone. 'Cause I'm gonna make this place your home. Settle down, it'll all be clear. Don't pay no mind to the demons that fill you with fear. The trouble, it might drag you down. If you get lost, you can always be found. Just know you're not alone. 'Cause I'm gonna make this place your home. Settle down, it'll all be clear. Don't pay no mind to the demons that fill you with fear. The trouble, it might drag you down. If you get lost, you can always be found. Just know you're not alone. 'Cause I'm gonna make this place your home. Just know you're not alone. I'm gonna make this place your home.
True, yeah. May family ako. I have a 5-year-old daughter. Hindi ako kailangan nag-dwell dito. I have to fight this big sea. So, yeah.
So how did Koji, your husband, react? How did you? Because you weren't married yet at that time, but you were together for a while now already, right? So you had Martina already by then. How did he react? Because you mentioned you were in the midst of planning for your wedding. You know, it's such a joyous time. How did paano yung reaction niya when you finally told him?
Naiyak siya. Naiyak siya. So, sinabi niya sa akin, kailangan mag-decide na kami agad kung ano yung gusto kong
Treatment.
gawin. Treatment. So, sabi ko sa kanya, you have to be there for me palagi kasi hindi ko lahat ma-absorb yung sinasabi ng doktor. Yung treatment and all. So, I have to have another pair of ears para ma-absorb lahat yung plan. So, before that, I only have it's October 2018 and then the doctor told me I have to do it the following month. And unang sinabi sa akin, I have to go through chemo. So, gumawa sila ng treatment plan sa akin. Like, neoadjuvant siya. So, I have to go through chemo, surgery, radiation, yun. Tapos, prior to that, they asked me if gusto ko pang mag-baby. Siyempre, I was 39 years old that time. Isip ko pa, gusto ko pa sana mag-baby na isa. And yung option is to freeze my egg before doing the chemo.
They asked that pala, no? That's affected. Okay.
So, usapan namin dalawa ng husband ko. So, covered ng insurance yung pag-freeze ng egg. We only have 2 weeks to do that. And on top of all na nangyayari, I think we cannot handle another, alam mo yun, yung another isipin pa na
Yes.
go through kami dun sa process ng freezing of eggs and everything. So, ang priority namin was gumaling ako. So, we did not go through that path. Chemo agad after like 2 weeks, we decided, sige na, treatment na agad. So, I had chemotherapy. Yung first chemo ko, it was so bad. Super bad. Na yun pala talaga yung mawawalan ka ng panlasa, mouth sore. That was only first na chemo ko. And
Sorry,
then,
how many rounds? Because there's like a treatment plan consists of like a whole cycle. So how many rounds were you supposed to take para we have context of it?
A total of 12 nung chemo, and then they told me there's a targeted therapy now, which is like 17 rounds then. So, aside from chemo, may targeted drug pa na ibibigay sa akin. But the first chemo didn't go well kasi nag-elevate yung liver enzymes ko. So, I had to stop. Bagong regimen na naman yung binigay sa akin. Because they have to
sorry. Yeah. So sorry, for the medical terms used, no, and just to simplify, siguro we have Dr. Mary Gay Buliat here to explain, kasi some of us might not know how certain cancers are staged, no. Parang simply put, maybe we can ask Dr. Mary Gay how you stage. So Ritzy had breast cancer. No? And she was given a certain regimen to follow, but not all cancers follow this kind of regimen. It will depend on what kind of drug is offered or what stage you're in. So, Doc Gay?
So from what I understand, I was actually quite listening to you, Ritzy. So you have a HER2 positive breast cancer, am I right? And it's a little, the tumor, I suppose, is big, and you have a positive lymph nodes. That's why they opted to do neoadjuvant. Okay, so I'm glad you receive actually the standard of care now. So for HER2 enriched, so there are basically different types of breast cancer. So it's not just breast cancer, that's it. So you have 4 common kinds. So you have the type 1, luminal type A, type B, and so forth. And what Ritzy has is what you call the HER2 enriched breast cancer. So it's an aggressive form of breast cancer, actually. That's why Ritzy, you noticed that the tumor growth was quite fast, right? Suddenly it's there. So that's the aggressive nature of the breast cancer that you have. And I'm glad that you actually received the standard of care. That's the best thing about what happened to you. So the chemotherapy, I think that you receive is a weekly one, right? So first you had the weekly chemotherapy or every 3 weeks. Sometimes we give it weekly, or sometimes we give it every 3 weeks, depending on the tolerability of the chemotherapy to the patient. So the chemotherapy is what you call, these are the conventional ones. So for you, I think you receive about 3 types of chemotherapy drugs. And then after you completed your chemotherapy and the radiotherapy, you had what you call your targeted treatment or what you call your anti-HER2 treatment. So that's probably Herceptin if you're in the US. So that's a very expensive treatment actually. Here in the Philippines, spending about 1.5 million to complete all the 80.
Wow.
Oh my
That's
gosh.
So in the US, it's subsidized by your insurance, so that's good. Here in the Philippines, you can be subsidized if you're in the government, but it's a very expensive. So on top of your emotional, physical, and as well as family stress, you have financial crisis. So I quite understand what you're going through, and I'm glad that you're actually, I mean, you have already completed your anti-HER2 treatment.
Yes, 17 siya, but I only completed 15. Again, they had my oncologist had to stop because of my calcium naman. So
So there are some problems, but don't worry. There are some studies that so long as you completed more than 9, that the effect will still be good. Okay.
I see.
So you're not on
Thank you.
treatment right now, right?
yes. So Herceptin, tapos meron pa rin yung I just wanted to share yung the Red Devil chemo, which is doxorubicin.
Wow.
Hey, Dr. Robin said that's
That's all.
the one that's making you feel bad. Okay.
Yeah.
So that's the one
By
that
the name itself, no? Red Devil.
yes,
Kind
it's
of.
it makes your
Okay.
urine red as well.
Wow. Okay.
So which actually went through a lot. So that's actually the survivor in her, and that's why she's still here. So quite admirable actually yung mga cancer patients who went through it and still have a positive outlook in life. Okay, so there's still hope. And actually, she did not do this just for herself. She did this for her child and for her husband, and of course her loved ones. That's what we have to understand about cancer patients. So probably they don't mind dying, but they mind dying because they will be leaving their children. That
I
is
would
what.
feel the same way.
Yeah.
Oo. Thank you, Doc Gay. So, Doc Gay is going to share some slides no, later on. But going back, Ritzy,
Sorry, I'm being
yeah, go ahead. Ritz, I'm so happy no, na parang to hear na you're in remission and you're doing okay. Parang, grabe. What an ordeal, no? Pero thank you for being here today to share with us your story. Okay.
Sorry, if I may ask, how did you stay positive? Kasi you mentioned all of of course, you're only human, you know, we see you now and you're in remission and the worst is over, so we hope. How did you stay positive through the treatment and then even after? Because, you know, it's like, it's such a threatening condition to be in your life.
Well, syempre una yung family. Yun yung iniisip ko. Second is, wala eh. I really need to do this kasi kung hindi, wala. It's gonna be, ako yun, matatalo ako and I did not dwell this for a long time. Kahit sa office, they were very supportive. So I'm very thankful.
So you were continuously working, right?
Yes. Actually, minsan after nung chemo ko, the side effects, mga after 2 to 3 days yan or after 5 days. Pero pumapasok pa rin ako or there are times when I am on chemo, naka-telework ako. So parang sa akin, this parang good distraction yung working na hindi ko naiisip na may sakit ako. So that's how I
Came out, you had a really good support system, no? Your family, your work, kind of like, you're under treatment, but you try to be as normal as you can and then focus on the things that you can control. Malaking bagay yung support ng family and you you being able to channel your energy there and be productive, right? Doc Camps, if are we going to MC? Because I don't know if we can ask about the diet. Because I'm curious about the diet that she's taking when she was in chemo and then after. I think we're curious about, and then Doc Ye can also mention parang what are the food that we should avoid or what should we take parang going towards prevention and management maybe.
Yeah. I think so maybe we can ask Ritzy what was the diet like, and then maybe after that then we can go ahead and proceed with Dr. Gay's slides. And then after we're going to interview MC naman.
Okay, thanks. Go
Okay.
ahead.
Yeah, so diet, walang binawal yung doctor ko. As much as possible, eat healthy, everything in moderation. Though mahirap kumain at that time, but I try to eat as many as I can. Basta less, sabi lang sa akin, less sugar. But not totally,
Take it out.
walang sugar. So, healthy eating.
So what was your comfort food when you were under treatment? Because sometimes when you feel down, you just want to open a bag of chips and have wine, but is that allowed? How do you try and de-stress somehow?
No, walang alcohol. Totally.
Okay. Oh my God. Hindi siya
Puro
Okay. So that's the one thing, right? Is that right?
Yes. Kasi sobrang dami na ng medication sa katawan ko. Even, actually, share ko sa inyo, these are my, if you can see, a bag of my medication. May narcotics siya.
I was half hoping to see a bag of chips.
Oo nga, akala ko nag-chips.
Diba? Parang we were
Parehong
talking
niya. Oo nga, nakakaloka.
Oo, okay. Grabe ang dami. Oo. So until now, you're taking those?
That's your
No,
main
So
tip.
those were the things that you took?
No, actually, siguro isa lang ang tinake ko dyan during my treatment. Yung tolerance ko sa pain was malakas. So, I didn't have to take, yung oxycodone, and yung mga iba pang pain medication. So, nandyan lang siya. Remembrance. But I have to dispose, actually.
Doc Cam, sorry, I would like to acknowledge our viewers. 18, wow, thank you so much, guys, for tuning in at 9:40 to 18 viewers. We have Doc Sheila Franco, Colleen Imperial, Ella Aquino, President Aisha, go girls, Ken Balsita, Roslyn Reyes, I think, was watching, Venus is watching, and then Pam Solis, Queenie Britos, and hi Ritzy, sabi ni Roslyn.
Okay, Lota is there watching all the way from Japan. Maan Rodriguez, hello. Teka, sino pa ba? Oh my God, ang dami nyo. Mamaya, babatiin namin kayo. So, going
For
back.
watching.
I just got curious before we call on Doc Gay, Ritz, si Martina was 5 already when you got diagnosed. And for a 5-year-old, parang, children see the world through our eyes, no? So I'm pretty sure you tried to avoid making it look serious for her, or did she have a lot of questions? Did you try to explain what's going on? How did you, of course, she was involved in the video. She was helping you shave your head, di ba? Parang, how?
How did you explain it to her? Because of course your husband, di ba? But the kid is different. Yeah.
Yeah, parang ang hirap ipaintindi na sasabihin mo sa kanya, mommy is sick, I have to go to the hospital every 3 weeks. So, ang ginawa ko sa kanya, actually, to make it lighter, which is very helpful then, was, why mommy got sick? Sabi ko sa kanya, because I don't eat vegetable. So, sabi ko sa kanya, if you have to eat healthy, you have to eat vegetable, you have to drink a lot of milk. So, yun, encourage ko siya na kumain ng vegetable through na nakikita niya sa akin. Kasi, but, you know, everything, parang normal lang din sa kanya. I mean, she saw me, lost my hair, yung mga side effects sa mga nails, and then there are times na ayoko siyang katabi. Kasi there are good days and
Good
bad
days
days.
and bad days. Yeah.
And if I may add din, nagpa-genetic test ako pala. So, I had an aunt. She was, well, she passed away due to breast cancer. But yung result ko sa genetic test was negative. So,
So it
So
wasn't
it means,
genetic.
yeah. Go ahead, Lynn.
It wasn't genetic because you said it's negative, I thought.
yes.
Doc Gay might bring light to this. Doc Gay, go ahead.
Kasi, sorry, breast cancer is 50%
Oh, yeah.
genetic. Is that right? 50%. Parang if you get it, if you have a relative, 50% chance of getting it. Is that right, Doc? Tama ba
Ay,
yun?
sorry. My internet is unstable. So, what did you do? What test? Is it the MAPA?
Yung test is BRCA, the large panel, 47 panel. I don't remember exactly, pero large panel siya.
Mm-hmm.
So breast and ovary, I think, kasama.
That's genetic sequencing, no? Is that right? They find out if you have markers. That's, yeah.
That's right.
So you don't have markers. Yung BC1 something, right? Meron yan eh. They have
Yeah, so parang it didn't come from the gene pool. I mean, the family.
it's not
you know?
hereditary. Yeah. Yeah, it wasn't
Oo.
hereditary. So it was lifestyle. Would that mean?
Parang yun nga, sinasabi nila, cancer galing sa lifestyle, the food that we eat, yeah, stress, that one.
Oh, okay.
Uh-huh.
Being a woman itself, no? Dahil we have breasts, so, you know.
That's true.
Yeah.
But breast cancer can also be found in men. So
I did not know that.
yeah. So
Sorry,
some
can you
men
hear
also
me
suffer
now?
from breast cancer. Yes, we can hear you, Doc Gay.
I mean, my internet is a little bit unstable here.
Okay, go ahead. We can hear you.
So you were asking me about. I was asking about the genetic testing of reads. So it was the MammaPrint or the CDX. What was the brand that was used? Because the breast cancer has there are some heredofamilial link. If you remember Angelina Jolie, so
Uh-huh.
her
Yes, oh, I was gonna mention. Showbiz ko
her
naman.
family carries the BRCA1 mutation, and there's another one, the BRCA2 mutation. So these are actually type of mutations that you can actually inherit. Okay, and it confers a significantly high risk of breast cancer on your children, even the male children. So yes, male, the dudes, the guys can have breast cancer actually, but it's about less than 5%, even less than 0.5% of all those with breast cancer. But it's an aggressive form of breast cancer because most of them have these mutations. So just because you're male, and sometimes male don't really seek consult
attention to- Yeah, oo.
when they have lump. It's internal. I mean, it's universal. Okay, so it's universal.
Yeah.
So by the time that they seek a medical consult, it
Malala na. Yeah.
Okay. So for REITs, most likely the known mutations or those single point mutations, we call them single point mutations because there's only one segment of the genes. Okay, but that's only a small portion of cancers. So most cancers actually do happen randomly. So we do not know. Okay, and for this breast cancer that are inherited, they are actually less than 5% of all cancers. So sometimes we just don't request for genetic screening, we do investigation first, so that we'll see, because these tests are expensive. So for the one that's done in the US, usually it will cost around, if it's in peso, it will cost around 180,000 pesos. So that's how expensive it is.
That's the genetic
Just for the test?
screening.
That's
No?
for the test, yeah.
Just the genetic screening marker.
No, it's not screening. They actually subject the tumor. The tumor itself, they genetic tests analysis. So they will see, they will find out if there are mutations there that are known to be linked to cancer or any form of cancer. So it's a good thing to do in advanced countries or developed countries like the US. Here in Asia, Singapore, Hong Kong, and Korea, South Korea, they do have this what you call tumor mutation bank. So they test all the tumors or the cancers that they do gather for mutations, and they have quite a good data. So it's how they detect repeat mutations that they say. So the common mutations across all cancers. So that's how actually they find out which mutation is associated with certain types of cancer. So your tumor actually has become one of the part of the database in the U.S. If it's subsidized by the government, well and good. It's good for science, but if it's out of pocket, sometimes it's not worth it.
Yeah. Okay. All right then. Okay, I think we can proceed to your slides, Doc Ye.
Okay, wait.
Yeah, very briefly.
I'll share my screen.
Oh, you can. Okay, go ahead.
Yeah, you can see. It's just my video.
Oh, sure.
Okay. You have to allow me to share my screen actually.
Wait. Oh, sorry. Okay, try. Or I can probably share it na lang para ayan. Okay, there, it's working. Okay, go ahead.
Okay, we'll start. Okay. So I'd like to change gear and put a little twist on my slide set. So I entitled it "Changing Our Perspectives in Cancer" on cancer, because you know cancer is always viewed in the bad light. There's no going around it. But perhaps this will put some new color on how we view cancer. So this is my usual day in the clinic. These are my some of my conversations with my patients. So take a look. Most of my patients are actually anxious and scared when they see me. Some of them will just say, "I'm here for chemotherapy," not understanding that chemotherapy is just one part of their management. It's not everything. Some would even come to me, resigned to death. So it's very sad when they just associate cancer with death. And well, we just have to talk to them longer. Sometimes, and this is very sad, and this is quite common here in Asia, especially in the Philippines, everyone in the family knows that the patient has cancer except him or her. Sometimes it's the family that comes first, telling me not to tell the patient that he has cancer, but telling me to treat the patient. So really, it's a little bit problematic. Okay? Sometimes patients have unrealistic expectations. Okay? They think they know better, they think they can treat themselves, and then they ask me to do something which, sometimes they ask me to do the impossible. Sometimes they get the information from the wrong person, and they expect me to correct something that was done bad. And actually, there's nothing you can do as a doctor. You have to do what's best for your patients from that point forward. Even if sometimes it's just human, you get annoyed. And the pessimistic one. Doc, may taning na po ba ako? Okay? So that's a very, very common statement coming from patients with cancer. So all in all, these are all about death and fear. And I mean, they are all anxious. So what do my patients have in common? Like Rich said, fear. Fear is pervasive in cancer patients, even among those patients who went into remission or who are cured with cancer. Fear about a lot of things, but fear because death, which is very distant while we are alive, suddenly has a face and a name, and that is cancer. There's hopelessness in them. You cannot help them. It's the first thing that they feel after fear, hopelessness, like they're going to die. Who's going to take care of my child? So, I mean, they lose hope, and sometimes it's quite challenging to give them hope and to tell them, yes, they can be cured. And this is the sad thing about having information, a lot of information in the internet. A significant number of patients are uninformed, or worse, they have the wrong information from the wrong source. And inadvertently, they don't get the treatment. So, and again, in the internet, uso na ngayon yung mga entrepreneur, very convincing entrepreneurs peddling their products that are called miracle products. So, and they are quite convincing. And I've met quite a lot of patients who were convinced, even, mind you, even doctors and other professionals. Patients feel that they are a burden to their family and loved ones. So you have to put your, sometimes they just don't undergo treatment because they think like, I'll just spend my money on my children's future. I'll die anyway. So that's sometimes they think that way. And then sometimes you have to convince them that treatment is worth going through. And then this is where a good family support comes in. So I take the time to talk to their family, to emphasize the importance of their support to the patient. And this is actually sad on my part as a doctor, because due to a lot of factors, there are numerous factors, they simply don't trust, and they simply don't have confidence in the doctor. And I'd like to be honest that sometimes it's also our fault. Sometimes as doctors, we don't take the time to talk to them. We're always in a rush. And there are actually quite a lot of doctors who don't know how to talk to patients. And I see this because I'm a doctor who is used to talking about death and cancer. So, and mind you, doctors actually are scared to talk to their patients about death. So this is, again, putting another perspective so that you as non-medical, non-doctors would understand why not all doctors are alike when they talk to patients. But of course, they teach us this in medical school, that the first thing before you can treat a patient is to get their trust or to establish rapport. But learning it and doing it in practice are two different things. So all in all, this will lead to cancer being labeled as a catastrophic disease. So that's why we call catastrophe, because it affects all aspects of life, even after death or even after remission. So why are patients' perspective or view of cancer so very bad? Well, it is cancer. There's no going around it. When you hear the word cancer, that's it. Right? Well, it's true. Cancer is quite a fearful disease. And again, not only, for doctors, we do treat, we can cure cancer. There's a lot of advancement in the treatment of cancer. But for the patients, it is cancer. But there are some things that contribute to this bad view of cancer. And those are myths and fallacies. And believe me, there's a lot. And I'm just going to mention some of them, the most common. First, eating sugar causes cancer to grow. Wrong. Okay, there's no evidence that eating sugar causes cancer to grow. Okay, let me explain. Okay. Sugar is actually the source of energy for all types of cells. And cancer cells are cells themselves. Just like normal cells, they have cellular activity. And for these cellular activities, it needs energy. And energy comes from sugar, which is glucose. So sugar, being the source of energy, is not exclusive to cancer cells. It's also used for normal cells. The only association between sugar and cancer is that eating too much sugar can cause obesity. And obesity is the one that increases your risk for developing cancer. So it doesn't make sense that when a patient undergoing treatment for cancer who doesn't have any appetite, you restrict the sugar. I mean, you're not only starving the cancer cells, you're also starving the entire body. So that's not good. So no, eating sugar does not cause cancer to grow, nor does it cause cancer to propagate. Getting biopsy makes cancer spread further. So I hear this quite a lot, and it's sad. Okay, and when I try to make sense of this, it's because some patients, for some reason, forgot that biopsy is not part of their treatment. That biopsy is just used to detect if their tumor or mass is cancerous or not, and they forget to come back. When they forget to come back and the tumor turns out to be malignant, of course, it progresses. And the last thing that they remember is the biopsy. So they blame the biopsy. So that's actually that's some of the conclusions that you can make. Another thing is when you do biopsy, of course, you cause a wound. So there's a wound over the tumor. When the cancer cells infiltrate the wound, that wound won't heal. And if it so happened that the patient did not come back to the doctor, it will grow even further, creating a very ugly ulcerating wound. And of course, they will blame the biopsy that was done on the tumor or the cancer tumor. But there's no evidence that says that getting biopsy makes the cancer spread. And you have to explain this to the patient. Explain the importance of them coming back. At the same time, tell them that not all tumors are cancerous and they might be interested or they might be happy to hear that. Chemotherapy is bad and painful. So, yes, it is painful. Just like any other drugs, it has a lot of side effects. But let us correct the term, so put it into context. Chemotherapy is not bad. Why? Because these are drugs that are meant to treat cancer or to cure cancer. And just like any other drug, they do have side effects. But unlike before, like in the 60s, 70s, 80s, or even the 90s, cancer treatment nowadays are actually quite advanced. And the management of chemotherapy side effects is actually quite sophisticated. Nowadays, we have a lot of medicine that could prevent cancer patients from vomiting. But I would like to be honest in saying that, yes, chemotherapy drugs are not your usual kind of drugs because they do have side effects and they are quite deadly if not used properly. And that's why you have medical specialists like the oncologists. We are specially trained to give cancer treatment, maximizing the benefit of the patients while minimizing the side effects. And you have to explain to the patient that this is what you expect. You expect to lose your hair, you expect to feel weak for the first week. So you have to explain to them so that they'll be prepared. But no matter how much I prepare my patient, it always comes as a shock to them. But you know what? My observation is that after the shock of the first or 2 cycles of treatment, afterwards, it's not so bad according to them. They got used to it, or their body probably tolerated it well. Okay, so how about chemotherapy is painful. Okay, it's not the chemotherapy itself that's painful. In fact, if the during infusion the chemotherapy is painful, then you have to stop it. It's actually what it does to the body afterwards. So, like Rich said, she feels the side effects after 2 or 3 days. It's because of the impact of the cancer, okay, of the chemotherapy. The way I explain it to my patient is that it's like your body going to war. So what happens if after, it's like 2 people or 2 boxers having boxing. So what happens after a round? They get tired. So that's what happens to your body. It gets tired. So there's nothing much you can do except to rest. So I advise the patient, rest for a week. And if you don't get better after a week, just inform me, because there might be something wrong with you. Because just like any other drug, it doesn't last in your body. It goes away after it has done its job. So the side effects shouldn't last. Okay? So you have to tell them what to expect so that they'll know when to call you. This one. All them pregnant patients can have chemotherapy. This is simply wrong. It's sad. Why? Most patients with cancer are old, because the older you get, the higher chances or risk of getting cancer. Pregnant. Yes, we do give chemotherapy to pregnant ladies, but it's okay, don't worry. Most people, not just you, even doctors are actually shocked when they hear me or see me giving chemotherapy to pregnant patients. We do give chemotherapy to pregnant patients. It's just that we have to explain the reason why we give the chemotherapy. Because the first thing that comes to mind, even doctors, other doctors, the first thing that comes to mind, what will happen to the baby if you give chemotherapy? But there's something that we forgot. What about the patient, the mother? After all, you need a live mother to have a live child or baby. So you have to treat the mother first in order for the baby to have a chance of being born. Of course, there's always that risk of the baby getting aborted or the baby having mutations or, inborn mutations. That's always the risk. But there is always this thing. Those are unintended effects. And for us oncologists, if there's something we can do to minimize that fetal adverse effects, we do it. For instance, if we could delay the chemotherapy until after the 3rd month, we do it. Or if there's a choice of chemotherapy that is less harmful to the fetus, then we give it. Okay? In fact, when I started, I've been practicing oncology now for around 8 years. I've had 8 pregnant patients who underwent chemotherapy already, and all of them gave birth to healthy babies. The eldest is around 6 years old now, and the patient, when she comes for surveillance, brings the baby with her. She calls her miracle. So that's the joy. Okay, when you see this evidence that if you treat your patient, there are actually happy endings. Oncologists don't want patients trying unusual treatments. Okay, they always say, doctors are just trying to find a way to make money out of patients. Okay, we make money because it's our profession, but let me tell you, if there are treatments or non-standard treatments that would help you, we will be the first one to advise you to do it or to recommend it. For instance, I tell my patients, you want to smell good? You want your environment to smell good because all you smell is bad? Use essential oils. Do you want a massage? Go to the spa. Do you want to soak in a warm bath? Then do it. Do you want to have music therapy? Then do it. Do yoga, do meditation. I tell my patient those things. But how about herbal supplements? I tell them, herbal supplements you have to show me, because there are certain types of herbal supplements that are not simply safe for you. So safety is the issue when it comes to supplemental or alternative forms of treatment. And it's very sad because, maybe they have a reason to think that, doctors are just making money out of them. But to tell you the truth, I'd like to believe that most doctors would have your best interest at heart. So have trust in that. Okay, another myth is that cancer will always come back. The thing is, this is the myth, but in the cancer survivor patient's mind, there's always the possibility that cancer will come back, okay? Well, there is what you call cancer relapse, but it depends again on the treatment that was given to the patient. It depends again on how faithful the patient was to the treatment regimen. But again, like I told you, we have come a long way from the 80s and 70s. Treatment of cancer nowadays is very advanced. In fact, we are rendering cancer which were previously incurable, curable now. Even stage 4 cancer patients, we can render them chronic, and the patient will just live like she does not have cancer. And we can do that. Superfoods can stop cancer. Okay, well, there's no other way of putting it. This is simply not right, not correct. There's no superfood that can prevent cancer. But it's good if you do believe it and practice a healthy lifestyle, that's good. So long as it's not in the, it's in that context. Next is, I live a healthy lifestyle and have no family history of cancer. I won't have cancer, and hence I don't need to ask medical consultations or didn't need to ask my doctors for some form of test to detect if I have cancer. Well, sad to say, all of us, I mean literally everyone, has a risk for developing cancer. I'd like to show you this one because I've been talking about alternative medicine and herbal supplements. There's this large study, okay, it's actually published, and they compared actually the outcome of patients who underwent their standard form of treatment, the conventional treatment, to those who underwent alternative treatment, including herbal medicines. And it's actually a conclusive evidence that those who underwent alternative medicine have a 2.5-fold increased risk of dying from cancer. And they just don't die. They die a horrible death because most of them don't receive treatment for the symptoms of cancer progressions. So they die in pain, they die starved, they die very bad. So I usually advise my patient, if you don't want chemotherapy, you don't want surgery, please, still you have to come back because I can still manage the symptoms of cancer. Not having chemotherapy, not having surgery, not having radiotherapy does not mean that I will not treat you. I will still treat you, but I will treat you based on the limitations that you have given me. So it's important to emphasize that to the patient. Again, mag-ingat po, just because some famous media told you that you do this, you do that, and look at me, I'm beautiful because I'm doing that, and you believe it. It's not, okay? So what can we do then? Number one, be aware and know your risk of developing cancer. Talk to your doctor about cancer screening. It's very important. And get the right information from the right source. So let's decrease your risk to have cancer. Do not smoke. It's an absolute no-no. Nothing good ever comes out from smoking. Limit your alcohol intake, and if you're not drinking, don't start. Do not get fat. Again, why would your doctor tell you to eat right and exercise? Not only for your heart and your brain, but also to prevent you decrease your risk for developing cancer. Because again, obesity is actually linked to a higher risk of developing cancer like breast cancer, colorectal cancer, and gastric cancer. Next is get vaccinated. There are vaccines that will decrease the risk of specific cancer. And lastly, have the courage to go for screening. So there are important vaccines in cancer. First is the HPV vaccine or the human papilloma vaccine. So let me emphasize that this is a pediatric vaccine. So you should actually, if you have children, talk to your pediatrician to have them vaccinated. And it's not exclusive for females. It can also be given to your sons. This is to prevent HPV-related cancers like cervical cancer, penile cancer, anal cancer, and some head and neck cancers. Okay, these are the numbers, why it's very important to have your children vaccinated. Next is hepatitis B vaccine. Why? Because more than 50% of liver cancer diagnoses are from chronic hepatitis B. So please have hepatitis B vaccine. In the Philippines, it's included in the EPI, or expanded program for immunization. So it's free. Let's go to screening. Breast cancer. Again, this is a poster from the Philippine Society of Medical Oncology, and there's a lot of posters from other countries. So 40 to 45, you can start having a mammogram at 40, but usually we start them at 45. So at 45 to 54, do annual mammogram. The type of mammogram, you have to discuss it with your physician. At 55, you can do it every 2 years. Now, self-breast examination. So there's no actually very good evidence that says that self-breast examination decreases the chances of having cancers, or in a way affects the detection of breast cancer. But it might help you seek medical consult. Like Chris shared, if she did not feel something in her breast, she would not have sought consult. So that's the good thing about self-breast examination. The best time you do self-breast examination, again, is when your breasts are not tender and painful. It's very difficult to do breast examination when they're heavy. So you do it a week after your menstruation. Colorectal cancer, you can start screening at 45, but usually you start at 50. And the best would be colonoscopy. So ask your physician about colonoscopy. Cervical cancer, pap smear is very important. So all women 25 years and above who are sexually active must undergo pap smear. At 25 to 30, it's every 3 years. At 30 to 65, every 3 years. HPV screening or detection, it's not really that recommended. It's the pap smear that is recommended. At age 65, don't bother undergoing pap smear. Lung cancer, only for selected patients. These are the smokers, the heavy smokers, and those previous smokers, but quite a significant smoking history, like they've been smoking for 30 years. So the screening is not just X-ray, it's CT scan. Prostate cancer, it's individualized. So for your lolos and your fathers, you tell them to talk to their doctor on what is the best, or when is the best time to have the prostate cancer screening. Again, it's individualized because we do not want to do unnecessary prostate biopsy, which is quite invasive and may have catastrophic side effects. Liver cancer, okay, there's nothing definite, but all patients with hepatitis B infection and those with documented liver cirrhosis must undergo surveillance, which includes AFP test, a blood test, it should include ultrasound, or CT scan, or MRI. So I'd like to share this. We live life not really thinking that it's only temporary until it has a name and face in cancer. But what about changing perspective? How about thinking that cancer is not the end of life, but an opportunity and chance to appreciate the value of life that was given to us? So you have to appreciate it even further when you think that you might lose it. That's how I tell my patient, especially those who actually lost quite a lot of hope. And these are some of the text messages of my patients and their family. Sometimes they thank me even if their loved ones die, because they died peacefully. Sometimes, even if it's an incurable cancer, they thank me because of the treatment, they spend more time with their children. Sometimes at 1 a.m., you're the only person who can reassure them that they're not doing anything wrong. And sometimes you're the only person that they would actually trust to tell them what to do. Sometimes there are patients who still have a positive outlook in life, even after going through cancer. And of course, those are those patients that are quite contented with life and actually are quite comfortable with death already. And sometimes the family or those that are left are actually become your patients, not because of cancer, because of the impact of cancer on them. And my role as a doctor to cure sometimes, to treat often, and to comfort always. Thank you. I mean, you can just ask me any questions later.
Thank you. Thank you, Doc Kay. Ayan.
Thank you, Doc
Okay.
Gay. Doc Cams, if I may, no, a few things, and I would like to thank everyone who stayed. Gusto nating i-acknowledge yung ating mga viewers. Thank you so much for staying through Doc's very informative presentation. A few things that I picked up. Sugar is not evil. Take note, sugar is not evil. I repeat, sugar is not evil. Huwag natin kalimutan yan. Okay? Malaking
Just don't get fat.
maraming salamat. Doc.
Yan, don't get fat.
And also, HPV vaccine for kids. Thank you, Doc, for that. I'm gonna inquire for my daughter because I have a daughter. So, pwede na pala siya for kids. It's something na parang...
Let me reiterate that. It's a pediatric
Okay.
vaccine.
Okay, yes, yun na nga. Pwede na pala siya kasi akala ko yung HPV parang, more mature.
Sexually
pero
active.
pwede na,
Yeah.
diba? Pero hindi pala. Pwede pala siya for kids. So that's something that I can explore for my daughter. And then 45 to 54 screening every year. This is the mammogram, Doc. Tama ba?
Yes.
Okay. 45 to 54 sa screening every year, ladies. Pap test every year, every 3 years pala siya. Yun naman yung akala ko, every year. So, ang pap test...
It depends kung anong nakita nung gynecologist mo on the most recent pap smear. If she's something a little bit concerning or a little bit abnormal, she may have to repeat it the next year just to make sure that you're doing quite well.
Pero kung normal, parang routine, pwede siyang
Every 3 years.
Yes.
Okay. I think Corinne's gonna tackle that later.
Yan, so at least ma-expound niya pa yun. And then finally, one thing that I picked up with what Doc said and I wanted to ask Fritzy before we move on to MC. Sabi niya kasi, and it struck me na parang, it makes you appreciate life. No? So, having said that, I wanted to ask Fritzy, what did you realize? Ano yung pinaka na-appreciate mo with what you have? Having gone through what you went through?
Yeah. Sa akin, what I realized after I went through this journey is to live day by day. Parang, appreciate every little things. Not to worry too much about my future or my daughter's future. So what is important is yung present. Kasi we don't know what's, ahead. So yun yung one thing na na-realize ko after this.
That is true. Sabi nga nila, life is what happens when you're busy making plans. So, yeah. Thank you, Ritzy. Thank you, Doc Gay, Doc Cams.
Yeah. Okay. So I'll just show the raw video now for those of us who just turned in their devices or just watching right now and who might have missed the first video that we presented. Let me just show the raw video of Ritzy and her husband and daughter, going through let me show you now. Hold on. Okay. This is the raw vid, no? Oh, sorry. Sorry. But were you able to see?
Yeah. Yes. It came out. Yeah.
Okay.
It came
Yeah.
out. Yeah.
Okay.
So again, thank you, Ritzy, for sharing your very personal journey. It's very courageous of you. I liken it to how, you remember how Chrissy Teigen showed her photos when she miscarried. It's very raw, but it's in telling people not to be afraid of it and really grab it by the horns and face it. Like what you said, di ba? Parang you can't be like, oh, I'm kawawa. Pero you have a family that you really fought for. And to include your daughter and your husband through it is such a powerful reminder of the strong support that you have. So thank you so much for that, for sharing this very personal video with us. Thank you. Ay, hindi kami naiyak. Oo. Ay, kasi nag-aano lang kami. Oo. Thank you so much again, Ritzy. Thank you. Doc
Thank you, Ritzy. Thank you, Doc Gay. Thank you. All right. So, okay. So, let's talk to our next guest, no? Like I said, si MC, she's the mom of 3. I'd like to ask her a few questions. MC?
Yes, hi, good evening, everyone. Good evening, Ate.
Hi, MC.
Hi, MC. So, MC, you're based in Baguio now, no?
Yes, Ate.
Okay. Huwag na ate. Cams na lang. Isang taon lang naman. Okay. So, going back, your son, Claby, how old is he now?
He's already 8. He's turning 9 this December.
Wow, okay. And he was diagnosed with cancer at what age?
He was diagnosed with cancer when he was just 2.
Okay. And during that time, what was his presentation? Bakit mo na pina-check up? Nakita ba to sa routine check-up with the pediatrician? Or did you notice anything wrong with him?
Actually, when he was just 6 months old, I felt a little bump sa may gluteal area niya, sa may butt cheek during changing his diaper. So, we decided to have him checked, and then advice ng surgeon is we have to have it removed. But then,
Okay.
di ba pag bata nga, you need to have CP clearance before having surgery.
Yes.
So we had to have check up with a cardiologist. Then they saw that he had an enlarged heart.
Wow.
So, kailangan muna naming mag-go through other tests. And then he was given the clearance to have the surgery. And then he was 8 months old when he had his first surgery. And then the test came out negative. And then around when he was 11 months old, changing again his diaper, nakapako ulit na merong bukol ulit. Same area, near lang sa where they removed the tumor. And then, pinabalik kami sa surgeon, and then decision was to have it removed again. So, he had his second surgery. He was 1 year, 2 months old. Ayan. And then, after his surgery, the results and the biopsy came out negative. And then, after 2 weeks, after his surgery, changing and cleaning yung sa sugat niya, sabi ko, bakit parang meron ulit? And then, we had it checked with the surgeon, and sabi is parang scar sa loob. Baka it's just a scar sa loob. And then we were observing, and then talagang lumalaki ulit. So we decided to change surgeon. And then the surgeons, yung naging next na surgeon, sabi niya is, we have to make a wide excision already. So he was already old. He had the wide incision, and then the test here in Baguio resulted to a negative result, but then we sent a sample sa NKTI.
Yeah.
And then results came out positive.
Positive for what exactly?
Cancer. And then when they were testing it, na parang kinonfirm more testing, it was fibrosarcoma.
Okay, so
Sorry,
fibrosarcoma.
for the non-medical person. What does that mean?
Okay.
It's
So, sorry, Ems, no? Pero when you say, well, yung type kasi ng cancer ni Clavi, it was detected as a small lump. So, when they had it removed, well, did they have to remove the entire thing and send it for testing?
yes, ate.
Okay, so it wasn't just a portion, no? Did they tell you where exactly, what level? Sa muscle ba? Or just the skin part? Or
Sa muscle. It was in the
sa
muscle.
muscle? Okay. So, yeah. Some cancers kasi grow in the different layers of the body. No? Yung, kunyari, the topmost is the skin, followed by the subcutaneous or yung taba, and then followed by the muscle. So, yung sa cancer ni Clavi, tumubo siya dun sa muscle. And I guess I could only imagine no, kung ano yung explanation ng doctor nung pabalik-balik kayo sa kanya. Kasi it's possible. Any wound kasi, or even a surgical wound that creates a scar. So baka naisip nga na yung nafe-feel mo na lump, it could have been just a scar from the previous surgery. No? Pero hindi rin kasi normal na parang pabalik-balik siya. So it's a good idea na nag-second opinion kayo. Yun. What was your question, Lane?
What kind is it? Kasi I
okay.
only got it parang it grew on the muscle, but like,
Yeah.
right?
Oo. So, yeah. Fibrosarcoma is a kind of cancer that grows from that layer of skin, from yung fibrous covering ng muscle. No? And when you say sarcoma din kasi, it has something to do with muscle cells. Yun. So, but anyway, si Sab will be explaining later on what it is. So, okay, MC, so aside from doing that wide excision, ibig sabihin, nag-cut sila ng bigger portion from his butt cheek, no? Para matanggal na, oo. After that, nawala ba? Or did you have to go through chemotherapy and may radiation bang kasama?
Yes, ate. After the results came out, the advice was to have chemotherapy and at the same time radiation.
Okay. So, it's very difficult na, no, na as a mom, na you see your child going through several operations, no? How was it during the chemotherapy? Nahihirapan ba siya? Like, si Ritzy, first chemotherapy pa lang, parang, di ba, she had it bad. So, how was Clavi then?
How did he, parang, kasi no, I don't know how, we understand what cancer is, but for kids, kasi yung kay Ritzy, she had to explain it to her daughter, pero ito happened to your son. So how did you explain to him why he had to do all those aggressive treatments? Kasi I don't think a 2-year-old, or, di ba, at parang why do I have to go to the hospital so often? So paano yung, how did you talk to him about it?
At first po kasi talaga, me myself ay parang nasa stage na hindi ko tinatanggap na he was diagnosed with stage 4 cancer. But then, good that I had my sister who was a nurse and my brother was a radiologic technologist. They were helping me really to parang to ma-sink in ko yung nangyayari. And then at the same time, they were the ones who were helping me to explain to my son what was happening. And then there were videos on YouTube explaining, cartoons really, explaining. There are uploaded videos on YouTube explaining what is cancer. And we had to show it to him. Yeah.
Anong reaction niya? Parang how did he take it?
Him being a very jolly kid, he was very light on accepting it. Siguro kasi nga kinalakihan na niya na he was having several surgeries already and he had several medicines for his heart. So parang continuity lang siguro nung mga nangyayari sa kanya, parang ganun.
That's right.
Yeah. Okay. So well, 2018, I remember you got in touch with me, no? Was that the time? Oo, kasi parang matagal na hindi kami nagkita ni MC, ganyan. Tapos parang it was such a pleasant surprise to hear from you. But at the same time, you were inviting me to join your cause, no? Parang, for those watching, si MC organizes Christmas parties, gift givings, ganon, for children with cancer. So every year yan. Yeah, oo. So parang yun yung naging advocacy ni MC because of yung experience nga ni Clabby. So yeah, meron ulit this year, diba?
Yes.
So yun, for those of us who would like to participate, get in touch with MC. We'll be sharing her Facebook. You can chat with her through Facebook. So, all right.
Sorry,
okay,
can I ask?
Yeah, go ahead, please.
Go ahead. No, I wanted to ask about the treatment kasi we know Ritzy. Of course, you know that the treatment is quite expensive, and Ritzy's was covered by their healthcare provider. Paano yung sa inyo? Because you went through like several diagnoses and then several surgeries. How did you manage that side of the treatment?
Actually, dun po ako thankful kasi very supportive yung family ko. And sa side ng husband ko, they've been helping me through all our expenses kasi nga, the type of cancer that Clabby had was a rare kind, and ill health didn't cover that much.
Okay. But he went to school? He was going to school through the treatment?
During that time, he was not yet going to school.
Okay. So, all right. Okay. Doc Cams, thank you, MC.
Yeah, all right. So, well, let's call on Doc Sab to share with us common pediatric cancers. MC, if you have questions for Doc Sab later on, pwede naman. All right. So, let me just share the slides of Doc Sab. Yeah. And we can see you also. Okay. Hold on. Let me share your slides, Doc.
Problems. I can do it.
Oh, go ahead. Sige. Try natin.
Me lang. Yeah. Okay, can you see
Nice. Okay.
my slides?
Yes, we can.
Okay. Wait.
Go ahead.
Okay. Lala. Oh my, wait. How do we do this? Okay. So good evening and good morning, everyone. After Gay's talk, I think it's really hard to follow. It was such a great lecture, and it was enlightening for most of us. So I will be brief and concise, and as much as I can discuss it in layman's term. Anyway, I am Sabrina Villanueva. For those who don't know me, Florendo date, and I am a pediatric oncologist. Okay, so I'll be talking about early detection in pediatric cancers. Okay, so this is lifted from our society's website, Philippine Society of Pediatric Oncology, and it is it says mga warning signs for children in English and in Tagalog. So for children, if you see that namumutla or palaging nagpapasa, nagdudugo, so it's also a sign that could be cancer, maybe leukemia. Or if you notice that there are lumps in the neck, or maybe in the kilikili or in the singit, could also be not only, it could maybe infection, but if it doesn't go away or it grows bigger over time, could be possibly lymphoma. And of course, if you notice that your child is not eating well, suddenly losing weight, also could be a sign of cancer. And in smaller children, if you notice when you take a picture of them, and then you see that parang may puti dun sa mata, also a sign of retinoblastoma or your eye cancer. And then when you are bathing your child, and then you feel that there are buccols, may lumps on the sides of the abdomen, so pwede rin yun maging sign ng cancer. And headaches, especially in the morning, And then, what else? Nagsusuka. So, pwede din yun sign. And for adolescents, if they complain of knee pains, shoulder pains, and especially at night, and there's a subsequent lump or may swelling over the area. So these are signs that you should consult your doctor na. And some patients or some parents would be agitated if, Doctora, I felt a kulani or a lymph node in the neck of my child. Could this be a sign of cancer? So you would say that it could be associated with infection, but however, if it grows bigger over time, but not painful or painful, could be maybe lymphoma. And it says here that if you have lymph nodes or yung mga kulani sa liig, you can observe lang over time as long as it doesn't get bigger. Okay, so I will just be discussing the most common signs for childhood leukemia. And like what I said earlier, you may have swollen lymph nodes, frequent nosebleeds, and then they would bleed easily. Night sweats. When we say night sweats, it's drenching, as in like the child basang-basa yung damit dahil sa pawis, especially at night. And of course, weight loss, and we quantify it like more than 10% weight loss. Laging pagod or ayaw kumain. Bone pains, yan. They would complain of bone pains sa gabi, especially at the back area. And they would have severe infections, fever, pwedeng every day, pwedeng every other day, basta they have fever, chills, and then they have red spots on the skin. And if you will palpate their abdomen, or you would feel their tummies, at the side of their tummies, may malaki ang liver or malaki ang spleen. And okay, for lymphoma naman, yan, usually may swelling sa neck. They might have like big kulanis in their kilikili, weight loss pa din, ayaw kumain, or hirap huminga because may bukol nga sa chest nila, pagod, and then there are some na they would complain of itchiness. This is what I'm talking about earlier. So if you have a younger child with these signs, like puti yung pupil, or nagsisquint na, namamaga ang mata, or mas malaki yung isang pupil, I guess it's time to consult your nearest pediatrician or an oncologist for proper treatment and management. Also, for younger children to adolescents, the most common cancers that they might have is brain cancer. So like what I said earlier, they will have headaches, especially in the morning when they wake up, vomiting. And then pag minsan parang lasing kung maglakad, may unsteady gait na sila. So this could point out to a brain cancer. Ayan. Also, we also have this kind of cancer in children, we call it Wilms. So it arises from the kidneys. So if they have abdominal pain, and you would see that they have blood in the urine with fever, as well as loss of appetite, this could point out to a cancer in the kidneys. And for older children and adolescents, if they complain of pain, and then there's swelling around the affected area, and you palpate a soft tissue mass with a painful limp, this could point out to a osteosarcoma. So all these signs, early signs and symptoms, if you see in your children, I hope not, or relatives, I think they should consult their pedia or an oncologist. The good thing about pediatric cancers is we have this collaboration with international and local groups that would help us in the diagnosis, the treatment, the management, the medicine. So we are fortunate to be in collaboration with your St. Jude Research Hospital in Tennessee, as well as well as SIOP and our local society, the PSPO, and of course, in Baguio General Hospital. So these are the groups that work together to deliver better care for pediatric cancer patients. Okay. It was just I don't like to go like medical jargon and all. So I hope
Thank you,
you
Doc Sam.
picked up something with that.
Of course, of course. Oo. So, okay, going back, no? Oh, hold on. Can you stop share
Stop
for
share.
a while? Ayan. Sorry. Okay. All right. So,
Okay, Doc
going
Sab.
back,
Go ahead, Cam.
I was just going to mention some of the comments, no,
Okay.
from our audience. Oo. Actually, one of our audience, okay, ma'am ng patient mo, Sab.
Hello, Pep. Yes.
Alam
Okay, so
kagad niya.
yes, si Pem.
Alam niya kagad.
Mahirap
Oo, so
insertan
parang-
ang anak ni Pem. So, tapat-ching-ching kasi siya. It's always a challenge when her daughter would come for
Correct.
insertion. My goodness. But Pem was really understanding during that time. She was our cheerleader every time na we tried to insert for her daughter. I think it's Elise,
Ayun.
if I'm not mistaken. I think Elise is her name.
Oo. So yun. So anyway, she just commented that you are truly a healer and you are excellent sa insertions.
And two socks. And two socks.
Yes, that's what she said. Okay. MC, do you have is there part of Clabby's treatment that you want, until now you're baffled with, that you want to ask si Doc Sab?
At the moment naman, ate, I don't have any other questions na. Actually, I just want to share to everyone that tomorrow is the last day of his 5 years remission.
Wow!
Oh my God.
Congratulations!
Nako, buong batch 96 magse-celebrate with you, MC.
Thank you.
Oo. Galing.
So,
Galing.
may I ask,
Okay.
5 years remission, what does that milestone mean for us that are not familiar, Doc Sam? What does a 5-year remission period mean?
Okay, I'll answer na gay. When you're diagnosed with cancer, usually you go through treatment, either neoadjuvant, meaning you give chemotherapy before the intended surgery. So that's neoadjuvant. And then you go for surgery, perhaps radiation, and then another round of chemotherapy. After the completion of chemo, you say that you are cancer-free at a certain time. So maybe in 5 years. So if in 5 years, you don't have a relapse or ibig sabihin, bumalik yung cancer, totally, you're free of that disease. So you can only say that if you have reached this certain 5 years. Gay, if you can add for adults, 5 years, 10 years, ganyan. 5 years survival. Pag nalampasan mo na yon, more or less, it might not come back.
Oh,
Chances are
amazing.
low.
That's amazing news.
Chances are low.
Yes, Ritzy.
I have a quick question.
Go ahead, Ritzy.
Kasi sa akin, after my surgery, I had bilateral mastectomy. So, so the doctor had to, yung biopsy ulit yung tissue and it came out negative. So, sabi ng doctor, clear ka na. But then again, after that, nag-radiation pa ako. So, that counts as, okay na.
Yes.
Yeah, right?
Grabe, no? Parang, it's true what Doc Gay said. Parang, you know, having cancer makes you realize what's important in life. No? You shared this with us. Now we realize it ourselves. So thank you so much. And I'm so happy. Super good news yan. Clabby, sa'yo, Ritzy, super good news. No? We continue to pray na sana tuloy-tuloy. Oo.
You know,
Right.
Talots had a
Amazing,
question.
amazing.
One of our viewers had a question about how the sun
Ah,
is.
yes. Anong sabi?
How is the sun? And this is great news. So thank you, MC, for sharing that. May I just say, our doctors, it must be so hard having to choose oncology as a specialization and preparing yourself to face this challenging disease
Yeah.
day in and day out. But look at their smiles. Very comforting. Very good bedside manner. I would be
Diba?
I would be very comforted. So Doc Sab and Doc Gay, with what you have to go through every day facing that and telling them, and Doc Cams, who's an ER doctor, we salute you for going in every day, choosing to do that.
Oh, yeah.
So thank you so much. It doesn't show because if you have to do that every day, then you must have a heart of gold to want to dedicate your. I'm not crying. So yes.
Ako yata ang iiyak. Nakakainis ka, Lynn.
Yes. No. I mean, seriously. Just a
It's
final
your passion
question.
and
No?
commitment.
Yes,
you
diba?
You want to, diba, Cams? It's our passion, our
Choose it.
commitment, our dedication to this profession.
How challenging is it now to do that in the time of COVID? Just a quick question, because there must be a change in some of the protocols that you have to do, right? And I will ask that also of Corinne later. Kasi the normal procedures don't apply anymore, at least during this time. So how different is it? Is it more challenging, or, it's just doubling down on the usual precautions that you've been taking all along?
Okay, who wants to go first?
Gay, go ahead.
Siguro ako.
Gay na
Sige.
lang.
Doc Gay.
Gay.
Okay. So, we're actually quite fortunate in Baguio City because during the entire pandemic, we actually business. So we closed it. Sometimes we close it temporarily when we have personnel to test positive, but that's the thing. Just the management of COVID, that make sure that it doesn't come into the center. That's actually the most important thing, because you have COVID, but there's cancer. If the patients don't get the proper treatment and they don't stick to the schedule, it will have a catastrophic effect on them. So it's the role of our hospital leadership to make sure that cancer management services go on. So there are some challenges, but they are not insurmountable. They're actually doable. And these are all meant to protect the patient as well as the personnel. So for now, we continuously modify our protocols, like who are the patients who gets tested, should doctors get tested. Personally, for me, because it's very catastrophic if I get infected and I infect my patients, okay? So I really have testing every 2 weeks. I subject myself to swab, to RT-PCR testing every 2 weeks. And I'm very thankful because I get it for free in BGH. That's a good thing about having access to this diagnostic test. So that's a good thing about Baguio City. We do have we do have the best testing capacity in the nation. And I'm not lying. You can just walk into the laboratory and have yourself tested. So it's unlike in other cities or even in the US. That's the good thing about here in Baguio.
I can attest to
so
that.
That's wonderful. And another thing is, make sure that the information gets to the patients. So we do have their contact numbers, and whenever the cancer center closes, we inform them immediately, and they do have access on when the cancer center services resume. So get the information to the patients and reassure them. Sometimes they don't like going to the hospital because they might get infected. So reassure them that
you see, the cancer center is physically separate from the rest of the hospitals. So there are pathways that you can take so that you can interact with other patients and make sure that you practice what you have been doing even before COVID. And that is to wear masks and observe proper hygiene. Remember, it's the cancer patients who actually practice wearing masks and proper hand
Yes.
hygiene before COVID. So you can easily identify
That's
a
so
cancer
true.
patient before because of the masks, right? So it's not that difficult for them. It's just this time, it's really mandatory to include all the family members. So, I mean, it's challenging, but I'm really glad that here in Baguio City, we do have a good system already in place. And we started it last March or April before this COVID became so quite, the increase in cases. The sad thing is that around 60 to 70%, as high as 70% of our patients are coming from the lowlands, Region 1. So because of the lockdowns, they can't come here to Baguio City. So we have to ask the other regional hospitals to continue their management. And the thing is, their service, the level of their service may not be as high as the one we have here in Baguio City. I mean, their access to chemotherapies and to targeted treatments. And believe me when I tell you, the patients here in BGH can have access to targeted treatment for free.
Wow,
That is the difference with
Wow.
other regional hospitals.
amazing.
Yes. So
Yeah.
that's it. It's a challenging, but it's not insurmountable. We can
Thank
always
you.
find ways to keep our cancer patients on track.
How about you, Doc Sab? Did you have to modify your management or because of COVID? Oh, you're on mute. Yan.
COVID happened and we were all surprised because of this COVID. So there were interim guidelines. The guidelines would change like from week to week, every 2 weeks, to swab, not to swab, to stop chemotherapy, resume chemotherapy, de-intensify chemotherapy. It was ever changing. So what we did was, of course, you have common sense to swab or not to swab because the swab was not available yet at that time. Now that there are guidelines, international, local, at least there's a pathway now of who to swab and not to swab. But initially, it was hard for the patients because they're immunocompromised and we don't want them going to the hospital often. They might contract the disease in the hospital. So it was shifted. The therapy was shifted from face-to-face, naging teleconsult. And then for the chemotherapy, kailangan maswab muna the bantay and the patient just to make sure they don't have COVID, because even cancer patients can be positive for COVID, even they don't have symptoms of COVID. And then some, we have to delay the chemotherapy for a while. We give it like every 21 days. We have to move it to every 28 days because of social distancing. Like in the hospital, tabi-tabi, di ba? Usually like 8 beds, punuin mo yung 8 beds. But since COVID happened, it has to be like 4 beds lang, ganyan. Para may social distancing.
That's true.
Yeah, that's it. What else? Yun. And then also,
So,
I think
go
that's
ahead.
it. Go ahead.
All right. So for me, I'm speaking as an emergency doctor, no? And it's totally different kasi we deal with the infectious. Sabi nga sa field of medicine, kami yung batang squatter.
Stormtrooper.
Oo.
Right? You're the stormtrooper.
Clabby! Hi! Wait. Let me
hello.
just spin your video. There's the star of the show. Hey, Clabby!
Hi.
I like your hair. You're like Tita Ritzy, oh.
Hello po. Hello po.
Hi, darling. You're not sleepy yet?
Not yet.
Not yet. Okay. So your mommy just shared your story to us. Yeah. We're really amazed and we'd like to congratulate you. I think you
Happy
deserve
Friday.
you deserve some ice cream and cake tomorrow.
At the very least. Also, lechon.
Oo. But we'll make sure you won't get fat, ha? You stay healthy. Pagagalitan ni Doc Gay if you get fat. Okay. All right. So going back, thank you, Clabby, for joining us tonight.
Thank
Okay,
you.
so going back no, sa ER, in any hospital at that, all the ERs are now divided into clean or cold zone and hot or dirty, no? And as ER physicians, kami yung nagmaman talaga sa COVID, no? I work in a DOH hospital, and all DOH hospitals have been assigned as COVID referral or clean. So, unfortunately, kami yung COVID referral center. So, tatanggap, kunyari naubusan na kami ng beds, priority namin ang COVID positive patients. So, sa amin talaga nagpupunta. And like Doc Gay said, we have to take responsibility for our own health. So, every 2 weeks or every 3 weeks, meron kaming mandatory swab. So, that's one way of how we make sure that we take care of our patients. At the same time, yun nga, the cancer centers or oncology units, usually of hospitals, are separate from the ERs. Kasi like Doc Sab mentioned, no, cancer patients are immunocompromised.
Yeah.
Kung mahawaan sila ng kung anong sakit kasi mababa or bagsak yung kanilang resistensya, mahirap, no? So, kaya as much as possible, pagka merong complaints, mag-telehealth or telemedicine sila, we seldom cater to cancer patients at the ER. No, as much as possible, they go straight to the clean portion of the ER if needed, if they are in critical condition. So, yun. Okay, wait, we were talking about screening. I think it's time, no, that Corinne shared something about screening before we show you the video. Okay.
No, but first I wanted to ask,
go
because
ahead.
Corinne also had an experience with cancer with her dad, if it's okay for her to share a few things. We were asking because this affects you differently because MC's was her son and Ritzy's was her personal journey. Yours would be your dad. So can you tell us a little bit about it that you're comfortable to talk about?
Just short lang. But so like with me, so gynecology, syempre we can't do any telehealth kasi talagang hands-on kami yung mga screenings and stuff. But when COVID started ng March, because I also assist in the OR, we pretty much canceled lahat ng elective cases, and even in clinic, only emergency. So around the same time ng March, it allowed me to actually go see my dad sa Florida because I live in San Diego, and just take off from work for at least 2 months because of COVID nga. And at the same time, my dad was diagnosed with pancreatic cancer. So it's been 6 months. He passed away nung May. But anyways, so he had a lot of surgeries before the diagnosis of pancreatic. So he had prostate cancer. He had a lot of back issues and hernia surgery, like a lot of surgeries, mostly elective. And then so when he started having symptoms, we weren't really thinking about pancreatic cancer. So his symptoms were that this probably started maybe later on toward the end of last year, where he was having issues with GI and back pain. And so, we're like, oh, well, back pain is really from his spine because he had a lot of issues with his back. So, all these parang random pain that weren't really parang telling us to, oh, maybe we should check pancreatic cancer, right? And then so eventually he had parang a diagnostic laparoscopy na procedure, meaning just to see what's going on because he's having all this pain. And in March he did the procedure, and yung doctor saw a tumor sa may umbilical area niya, like the peritoneal area where yung lining ng abdominal cavity mo. He had a tumor there, and they started doing testing. At first, we thought maybe colon cancer, and then initially they thought nag prostate, when he had his prostatectomy, baka bumalik yung prostate cancer and may have spread dun sa peritoneum niya. But anyway, in the end, it was pancreatic cancer advanced stage. So it nag-metastasize na, meaning spread na it started from the tail of his pancreas and into a little bit of his liver, and then ang telltale sign na nag-metastasize na is it went to yung lining ng abdomen niya, so it was yung peritoneum. So, you know, like with him, he considered chemo. He considered chemo just, I think he did it for us, really, because he found out in March, and then he started chemo in April. Sorry, it's still. So anyway, he only had one round of chemo, and it's funny because before he started chemo, they were telling us yung type of chemo drugs niya will make him feel really cold, like really sensitive to cold. So try to stay away from anything cold, no ice, yung ganon. And then, so we were given all of these precautions na make sure na yun nga, will keep him comfortable. Pero when he came home after yung chemo, he was so hot, he was sweating bullets, yung ganon. So complete opposite nung list na binigay sa amin. And so it really, to each their own, right? Like yung patients, you can only give guidelines to patients, but honestly, every cancer patient has their own experience and how they react to the drugs. And with my dad, he was in so much pain. So I think unless you really know someone, or unless you have personally experienced cancer, it's, you wouldn't really know how extensive yung pain is, especially with my dad, yung pancreatic cancer. He had so much pain going into chemo and after, and I was just really glad I had the opportunity to be there for him. See, my dad doesn't have any medical background, so, and my aunt, si Tita O, yung mommy ni Tin, and then si Tita Sue in Florida, and then her husband, si Tito Bench was his physician, tapos, and then Mia is there. So it was just, it was hard for us to see because we knew what was going on, and it was also maybe comforting for him to know that we were there to kind of explain to him what's going on. But honestly, I think the mere fact that I had the chance to be with him for 2 months gave me the opportunity to just be there for him. Iba yung feeling niya with yung physical support and emotional support, and all throughout until the end when he passed away. Ang nangyari kasi sa kanya, he had yung chemo, and then after that he was in so much pain that he was on pain meds, like talagang lahat na, and oxy and fentanyl, everything, like the highest na pain meds, and it wasn't really helping. So he got really constipated until we had to send him to the hospital. And at that time it was COVID, so we can only go sa ER, and then isang tao lang sa ER, and then they would wheel him to admit him. So we couldn't be with him, we couldn't stay with him. So he, with cancer also, with his type of cancer, it made him sensitive, or made him gave him a higher risk of developing blood clots. So with him, he had blood clots from his groin down to his ankle sa right side, and then so talagang both sides he had clots all over. So it kind of naging ripple effect, and so he had a major stroke. So, and, you know, we couldn't be with him sa hospital, and finally we were able to take him home sa bahay, sa house, and take care of him until the end. We did. It was more of palliative care na after that, and just made sure that he was comfortable, no pain. But you know, like you never really think about, because you know you think because he was 61, so you
Wow.
don't really think na it would happen until it's really happening. And it's pancreatic cancer is the most aggressive, and like you know, it's, we don't really know a lot about it, and yung mortality rate is really high. I mean, if you see Alex Trebek, just passed away, and there's a lot of people that have pancreatic cancer. It's mostly, if advanced na talaga, it's mostly palliative care, right? And I know my dad tried so hard for us, but you know, eventually he was in so much pain. You know, you kind of have to really be ready to say goodbye and give him yung peace of mind that he you know, he can go and will be okay. But my experience with my dad gave me a better understanding of what cancer patients go through so much. And Ritty and you know, Mel, you guys going through yung cancer experience na yun is really inspiring. And I mean, kudos to all of you guys, and like the Sab and Doc Gay, you know, it's hard enough for the patients, but also the family to find a provider that can give you peace of mind and really support you, not just medically, but also emotionally and psychologically. It's hard to find yung combination na ganon, just to find the strength to try to move on and be inspired regardless of yung pain and you know, negative experience. So anyway, that's my experience with my dad. And so it's been 6 months, and it's tough, but we will, you know, move on.
Thank you for sharing, Hooks. I know it's really hard, no? I mean, it's so fresh pa, and yeah. But anyway, it's also a good thing that when he went through those difficult stages, you know, parang lahat kayo nasa medical field, and that might be assuring for him. I mean, it might have given some assurance na, you know, I might not be okay, but at least all the people around me are my loved ones, and that they know what they're doing medically, diba? Parang
I think it was more comforting for him to know that family members are taking care of him, not just some random strangers from the hospital. Yung ganon. So that's why we really hated the time na nasa hospital siya for about a week. Kasi he was getting, you know, iba pag yung pamilya mo are taking care of you. And even though, you know, even though we couldn't do anything, it was more of like staying at home. And you know, I remember he was saying, yung guidelines on what to eat and what not to eat, or ano, sabi niya, you know, I'm just gonna eat what I want, parang ganun. Because it was different experience for him. But thankfully we had yung resources to take care of him at home until the end. So he was surrounded by his family until the end. You know, mahirap with COVID. Once, you know, it's hard, especially for not just cancer patients, but COVID patients just going through this whole experience by themselves without family members around them. So, yeah.
It's true. So, yeah, okay. You're going to share about screening tests, no, that women at our age need to undergo. Are you okay ka na ba?
Yeah.
You wanna take a breather? I can share a video muna while you compose yourself.
I'm okay. It's up to you. You can share the video first. Pang ano lang.
All right. Sige. So, Cooks, you ready?
Yeah,
Go
sure.
ahead, share. Okay, share your slides.
Okay. So I'm going to be really quick lang. I only have one slide. So, all right, can you see it?
Yeah, we can.
Okay, so I found this really parang snapshot of screening for women in their 40s. Extensive na yung talk namin from the first SNL. So I just wanted to point out some highlights. Si Doc Gay already mentioned screening, so just some pointers. So it says turning 40 is a milestone and often a time of transition in life. So average age of menopause is 52. Perimenopausal just means you are transitioning into menopause. So it usually starts around 47. We kind of have a long, maybe at least 7 years to go before starting perimenopausal. But it's good to be aware of your own body. Honestly, anything unusual, like let's say monthly yung periods mo, and then all of a sudden you're having periods every other 2 weeks or something like that, or parang heavier yung periods mo, which you haven't had heavy periods in a long time, or you're starting to skip periods, or let's say you're having pain or bleeding with intercourse, yung mga ganon, something unusual. If you have a gut feeling na something's wrong or something new is happening to your body, you know your body best. So kami, like the providers will provide you with the testing, but we can't do anything unless you come and see us. So especially even with COVID, if something is just not right, weigh yung risks and benefits mo, and it's always good to see your provider just to make sure, because you never know, diba? Like with Ritzy, doesn't look like your family history niya it puts her at a higher risk for breast cancer, but for her to do a breast exam and find something new is always a good thing. So it's always good to be aware of your own body. So here it says monthly self breast exam. Yung breast exam is really, it doesn't have to be monthly. It doesn't have, it's not even recommended anymore, just because a lot of women have dense tissues, especially kung medyo enlarged yung breast mo, and then sometimes it just provides it causes more anxiety for people to do yung monthly self breast exam. However, it's just like I said, it's just good to know a new baseline mo. If you have dense breast tissue, you'll always find different, kasi if you do regular breast exams on your own and you are aware of your own body, then you would know if something's different. Yung annual screening here would be a clinical breast exam. We kind of stay away from clinical breast exams now unless we think you are at a higher risk. And then also, if we always say, oh, are you feeling anything new, that you would want a breast exam. Blood pressure check, blood test, cholesterol testing. So we say if yung pap smear, you're not due for a pap smear, but we would still recommend you to see your gynecologist or your provider annually for a pelvic exam, because a lot can happen within a span of 1 year. And we want to make sure that you are aware of yung mga symptoms mo. Mammogram right now, as Doc Kay said, it's honestly, yung genetic testing na si Ritz was saying, here's states we can offer genetic testing at a lower cost. It's called Invitae genetic testing. So it's really like a kit for parang screening. I'm not sure if Ritzy, if you did that, yung Invitae, and yung cost ng out of pocket of the genetic testing is $250. But it's not an extensive screening for genetic, disposition to cancer. However, yung genetic testing or any type of testing with cancer is really just a tool to help you, parang to help you be more aware of your risk for developing cancer. So it can tell you, oh, yung, like we usually recommend if you have 2 or more family members na mostly maternal side, so if your mom or your grandma from your mom's side, and if they were diagnosed early, you know, younger than 50, then we would suggest genetic testing to see if it really is genetic based, right? If it runs in the family. You know, so 2 or more. If you have like one family member, maybe distant cousin or aunt, you know, we would just help to say, okay, just be aware, do regular checkups, yung ganon. Pero if you have 2 or more, let's say if your mom and your grandma were diagnosed at an age na 40 or 30, ganon, then we would be more heightened and recommend more testing. Usually mammograms, we tell our patients, if you have a family history of breast cancer, let's say your mom was diagnosed with breast cancer at age 40, then we would recommend 10 years prior to your mom's age. So we would recommend earlier than 40 for you. For example, like at age 30, we would do like a screening mammogram. And then, so basically mammogram right now is based on your risk of developing breast cancer at age 40 or younger. And then kasi maraming different guidelines. Other people say you can start at 45 or at 50 every 2 years, but it really depends on your risk for developing breast cancer. If it runs in the family, then you start early. Yung colonoscopy, Doc Gay already explained to you guys. So colonoscopy, mostly at 50 every 10 years, but there is an actual test that you can do annually, yung where they check blood in your stool. So if you have any family history of colon cancer or anything like that, then they would start earlier. So I'd like to, my main goal is preventive screening as a gynecologist. So yung pelvic exam and pap smear. So pap smear itself, we start at age 21. So 21 and until age 65. So depending on your results on pap smear mo, with the pap smear, if it's just the pap smear itself, basically, if it's normal, then you can have it every 3 years. But it's really different guidelines, states versus the Philippines. But we always recommend HPV testing with your pap smear at age 30. The reason is we don't test for HPV at a younger age, younger than 30, because most of the time HPV yung immune system ng body mo can suppress yung HPV. So it doesn't fully get rid of it, but it won't show up sa test. So at age 30, we always add an HPV test. So if you do have an HPV test with your pap smear and it comes negative, you can have it every 5 years. Pero kung walang HPV test, then it's every 3 years. Yung HPV vaccine, we recommend starting at 9 years old. The main goal of the vaccine is to prevent yung HPV, right, that can cause cervical cancer. And we recommend that it be given at 9 or at least prior to having intercourse. Because HPV is a sexually transmitted disease. So anyone who is sexually active can get it. It's very, very common. And there are types na HPV 16 and 18 are the most aggressive ones that can cause cervical cancer. So right now, FDA has approved the vaccine until age 45. Because even though you have HPV, it can prevent you from, from other types of HPV, because there are different types of HPV. So it's a conversation that you can talk to your doctor about, but I would recommend it sa mga kids natin, especially make sure that they have it before they start being sexually active. And so it starts at 9 years and 9 to 14, but over 14 you can still get it. So cervical cancer really is the only cancer not genetically related, because it's only caused by the HPV. So ang pinaka take home is cervical cancer is preventable as long as you have screening early. Yung cancer naman, like cervical cancer, is caused by HPV. And so if you have regular testing like a pap smear, then you would be able to detect any cancer or any cancerous changes on your cervix, and then it allows you to have more options with treatment. So honestly, a pap smear is, I'm not sure how much it is Philippines. I was trying to look it up, and I think it's, magkano ba yun? 700. I think it's 750 pesos or something like that. I'm not really quite. It's gonna be more affordable to have the pap test compared to having cancer treatment. Once it's already advanced, then you have to have a hysterectomy if you stuff like that. So as a gynecology NP, we really focus on preventative, on screening, because if we have these screening tools, it will help us be more aggressive, or at least assertive with our treatment and with our health. So like I say, my dad with pancreatic cancer, he didn't have that option kasi there's really no screening for pancreatic cancer. Symptoms start pag advanced stage na. So but with cervical cancer, endometrial cancer, these things are very preventative. So if we have yung screening tools, I always recommend having itong screening, regular screening, because you never know. Like with Ritzy, you never know, right? Even if wala sa family history niya, you can always, you really don't know if you have cancer or not. So regular screening is the best, especially a really simple visit and yung pap smear is just 1 minute of your time. It can be this uncomfortable, pero if you think about it, always you have to focus on your health, right? Preventive health more than treatment or anything more invasive than that. So my main goal is like if you have anything, like I said, if you have any abnormal bleeding, any pain, pelvic pain, usually with ovarian cancer, you have some bloating and some pelvic pain. With HPV or cervical cancer, you usually have pain with intercourse or bleeding with intercourse. And some people are asymptomatic, meaning you may have yung HPV but you don't have symptoms. And it doesn't mean I know some people will be like, I'd rather not know kung may HPV ako or if I have cancer, but really it's better to know so you can decide on what to do, right? So also, if they say, oh, sige, we did your pap smear, normal naman yung cervix mo, but you have HPV, it's a really common virus, right? So it's nothing to be ashamed of. Sometimes people don't want to do yung pap smear and they think it's really for people who are not monogamous or people who have multiple sex partners, right? But honestly, if you have HPV, some people are asymptomatic, and it doesn't mean that you already have cancer. You get cancer if you are not regular with your screening. Kasi once you have HPV, mas regular and mas like yung the PAP testing would be more regular compared to 3 to 5 years. So it's best to know if you have HPV, and then that way we can take care of you and guide you through yung mga testing, follow-up testing. So pretty much yun. I had like a visual aid, pero wag na, kulang na yung oras. But I wanted to show you my...
Hold on. Before you show your gadget, maybe stop share muna so we can zoom in on your...
Okay, I'll be really quick. I just wanted to show
sige,
you.
go ahead.
Ayan.
Okay, sige.
Stop share na. Is that good?
Yeah, good. Okay.
Okay.
So, yeah, what was that you wanted us to see?
So pretty much for the pap smear.
Ang laki niya na, nakakatakot.
I know, this is usually for, yung mga nagkaanak na. Wait, I want to show you my, we have smaller ones, but you can always tell your provider, can you please be gentle and then use the smallest speculum, smaller than this. But anyways, syempre we lube it up. So with pap screening, we pretty much, it just allows us to see yung cervix coming from here, right? And then pap smear, pap screening would just be a quick cytobrush, and then that's it. Like maybe 2 minutes of your time, and then after 3 years, then you just come back, hopefully normal, right? Another thing is, if you are not just menopausal, but I was telling you, if your mom or whoever is menopausal in your family, and then they have even just a little bit of spotting or bleeding, that's a big thing for us. So have them see yung provider nila, yung gynecologist, because you shouldn't be bleeding or having any spotting after menopause. For one thing, wala nang estrogen, so yung lining, and so you shouldn't be having your period. So some people say, oh, maliit lang yun, spotting lang yun, and then they don't really think about it. It's good to rule out endometrial cancer for menopausal, and also for women who are 45 and then suddenly have heavier bleeding, like really heavy bleeding. Any change in your menses would cause some concern. So this is a really small plastic pipelle that we put in inside, like inside yung papunta sa uterus. It just allows us to get a biopsy of yung lining ng uterus. So here's your uterus, right? And then we insert it and then get some samples of the lining of the uterus. Pag menopause ka, it's usually thinner. So yung lining mo is thin na because you aren't menstruating. So if you have an ultrasound done, and then yung lining ng uterus mo is pretty thick, then that's a cause for that's a concern for us. And so we do a biopsy to make sure it's not cancer. So this is maybe like the ugliest looking uterus because it has all of yung mga worst case scenario.
Yeah.
So, yun lang. Anyway.
Okay. So thank you.
Thank you for the demonstration. Yeah. I appreciate that it's plastic. Sometimes it's metal.
Yeah, iba yun.
So it's cold. Sorry, it's already 11:30. So meron akong flashback. But thank you so much for that. Somebody told me once na for you not to forget when you take it, maybe you can take it during your birthday, kind of like a gift to yourself. So you do it like at the time when you will remember it, like renewing your driver's license. So yes,
that's
true. Thank you.
Okay, I didn't realize that the last video I played didn't have sound, so I'm gonna play that towards the end of the program. Do we have questions for our guests tonight? Just one question from Lota, if placenta vaccine daw, I'm not sure if that's, but can it avoid perimenopausal flushes? I'm not sure if this is an in thing in Japan, placenta vaccine.
I haven't heard of placenta vaccine. Sometimes yung mga hot flashes, really HRT or hormone replacement therapy, we reserve that for people who have really bad hot flashes, right? It can put you at higher risk for breast cancer, pero some people it is safe, and for some people it's not. The only thing is, it doesn't stop menopause, really. It's just HRT or hormone replacement therapy helps you transition, and it bridges yung gap between yung perimenopausal to menopause. And a lot of people try yung black cohosh. It's like an herbal supplement. Some people don't like hormones at all, so it increases them yung risk nila, right, for cancer. But yung black cohosh, it doesn't have any estrogen in it. It has, vitamins and herbs and all that. That has been, I guess, proven.
FDA approved.
It helps. Yeah. It helps with hot flashes. It just helps with hot flashes or night sweats. Ritzy, have you heard of it?
Yes, I was just, I had my annual checkup yesterday, and I asked my primary doctor about medication for hot flashes. Kasi I'm taking exemestane and goserelin. So, hormone medication siya. So, every night, naka-fan talaga ako. Hot flashes. Sobra. So, yan. Nirecommend sa akin yung black cohosh and exercise.
Okay. So, I hope that touched on what Lotta was talking about. All right, lots more comments. Sorry, we might not be able to answer, but we will once we review the feed, no, sa FB page natin. Okay. Other questions from our guests? Ritz, do you have any questions?
Last na lang, you might know or do we have a way to check if menopause na yung tao? Like me, I don't know because I'm taking exemestane. So I don't know if I'm menopause or not, or when.
When was your last menstruation? Sorry. Let's save that for a more personal. Sorry. I know yung pagka-doktor ko lumalabas, hindi ko okay. I have to hold that.
Hospital. What was your last? Okay. Yes.
So sorry. We won't ask about personal stuff here. Oh my God. Sige.
When was the first day and the last day? Yeah.
It's hard. I think it's hard to like with us, menopause age 52 average, right? But other people start earlier. It also depends on, it can mimic yung when your mom had menopause, yung age. We usually do hormone testing. So we would check yung FSH and then LH and some estradiol levels to see if kung elevated, then you are perimenopausal or menopause. But honestly, ang diagnosis of menopause is if you haven't had a period for 1 full year. So 1 year.
Oh, wow.
1 year talaga. And if, let's say, 3 months wala kang period, and then it came back, and then wala na naman. So that's more like perimenopausal stage. Really, ang menopause, perimenopausal stage is really just a time to, we just need to help you with symptoms. So symptom relief lang talaga, and there's no way to make it earlier or to parang delay menopause. So it's really symptom relief of hot flashes, night sweats, vaginal dryness, so ganun. But it's hard for you, I think, Ritz, kasi you're taking hormones, right? You're using hormones. So to do a level of your hormones would be inaccurate kasi it can be elevated. Telling us na kung elevated, is it coming from yung hormone pills mo, or it's really because you are perimenopausal or menopause. So it's tough.
Thank you.
Okay, thank you.
Yeah, thank you.
Yeah.
But very quickly, what I picked up was, the average is, it starts around 47. So, comment lang ni Aisha, may 7 years pa daw siya para manganak. Sabi ni Doc Sheila,
Ninang, I volunteer.
Pang-harvest na daw siya ng eggs. Sabi niya kay Aisha, promise, papa-freeze natin. So, meron siyang pinag-iisipan. May kang ibang episode naman yan, paano magpa-freeze. So, Thank you. Thank you so much. Doc Hams.
Yeah. All right. So let me show a video, no? Baka inaantok na ang mga tao, but this is very special. Oo. And to be honest, no, when I was preparing this, talagang hindi ko mapigil yung luha ko. Pero, well, let's see. Okay,
We're coming
here
back
goes.
after this, right? We're coming
Yes,
back.
yes, we are. We're
Yes,
still
we're
coming
coming back.
back. We
Yes,
have a
yes.
few announcements. And of course, yung acknowledgements natin. And then lastly, I will play again the video that didn't have a sound kanina. So sorry about that. Okay, let me share this vid.
You with the sad eyes, don't be discouraged, though I realize it's hard to take courage in a world full of people. You can lose sight of it all, the darkness inside you can make you feel so small. But I see your true colors shining through. I see your true colors. That's why I love you. So don't be afraid to let them show your true colors. True colors are beautiful like a rainbow. Show me a smile then. Don't be unhappy, can't remember when I last saw you laughing. If this world makes you crazy and you've taken all you can bear, you call me up because you know I'll be there. And I'll see your true colors shining through. I see your true colors. That's why I love you. So don't be afraid to let it show your true